I'm talking today about the effects of cancer and cancer treatment on the pelvic floor and the benefits of physical therapy. The objectives of this talk are first and foremost to define the pelvic floor, this group of muscles, identify how cancer and cancer treatment can affect the function of the pelvic floor, review the bladder, bowel, and sexual symptoms that result from the impact of cancer and cancer treatment on this muscle group, and discuss the role of physical therapy in treating pelvic floor dysfunction. So let's talk about the pelvic floor first. It is a group of muscles and it quite literally makes up the floor of the pelvis. It extends from the pelvic bone in front, which is at the top of this picture or diagram, to the tailbone behind, which is at the bottom of the picture, and attaches on, in many other places as well, side to side at your sit bones. But you can think of it as a parachute almost, or a hammock that helps to support, as a group, they act to support the pelvic organs. They individually have roles, and we'll talk about those in a moment. There are several muscles that make up the pelvic floor. It's 3 layers deep. There's a right and a left. Here's a few pictures maybe to give you a little bit greater appreciation for the pelvic floor. This picture to the left of this slide helps you appreciate the proximity of the hips. Pelvic floor, of course, sits there in the middle. This is looking from the back side of a female pelvis. The top right picture is looking from top down into the pelvis. And you can kind of see and appreciate the bowl shape of the pelvic floor. And you can see the 3 openings quite clearly there, with the urethra being in the front or the bottom of this picture, and the vaginal opening there in the middle. The anus sits behind. The bottom right picture shows you one side of the pelvic floor removing the soft tissue, that skin layer, so you can just kind of appreciate pelvic floor from that angle. Individually, these muscles have separate roles, and they are sexual, bladder, and bowel functions. When we think and talk about sexual health, the role of the pelvic floor is to allow an orgasm. Bladder function, the pelvic floor helps to contract, or it does contract, and helps to keep you continent with the sphincter muscles. So sphincter muscles are not included in your pelvic. They're not part of the pelvic floor. But when pelvic floor acts with the sphincter muscles, it helps to close the urethra and keeps you continent. And of course, when it relaxes, it helps to open the urethra and release urine. The same is true for those muscles that are more responsible for bowel function, and that together with the sphincter muscles, they are going to help to keep one continent and hold back gas. When those muscles release with the sphincter muscles, it allows for you to have a bowel movement and pass gas. How does cancer and cancer treatment affect pelvic floor function? Well, actually in several ways, one of which is the effects of cancer itself. So cancer can be painful, can cause lots of worry and stress, can make one very tired, can disrupt changes in routine, exercise routines, the day-to-day. And that will affect the muscular system, specifically the pelvic floor, depending on where the cancer lives, right? A little bit here. Pain, or I should say muscle guarding, is a direct response to pain anywhere in the body. When you get pain, muscles around that area are going to tighten and splint, which is what they ought to do, and a really great role in the short term. However, when the pain is long-term and long-lasting, continued muscle tension can cause pain itself. So we don't really want it long-term, right? Fear and worry and stress also can make somebody tense throughout the body. And then with disuse, maybe less exercise, lots of fatigue, the pelvic floor and other muscles can become atrophied and weaker. Cancer treatment itself can also impact pelvic floor. Chemotherapy can alter hormone levels, specifically estrogen, depending on the type of chemotherapy, right? Lower levels of estrogen result in decreased blood flow, decreased muscle bulk, and decreased skin flexibility. Chemotherapy is great at killing cancer cells. Unfortunately, can also cause healthy cells to be damaged. And this damage can cause decreased sensation and nerve pain. Radiation burns cancerous cells, but it can lead to scarring and restrictions at the muscular level. And surgery, of course, is very helpful in removing cancerous tumors. But in order to make those surgeries possible, there could be scarring, first of all, but also disruptions to the muscular system. There has to be sometimes cutting through other healthy tissue that can cause damage. So of course, all these treatments they're treatments, and they are very helpful at dealing with and treating cancer, but they can have side effects. And these side effects and symptoms are the following. So urinary frequency, urgency, and incontinence is possible. Fecal urgency, constipation, incontinence. Pain, pelvic, lower back, abdominal, perineal pain. Pain with urination, bowel movements, and sexual activity. And difficulty achieving orgasm. And this isn't going to be the case for everybody. And certainly also depends on where the cancer is and what the treatment will be for that. But these symptoms are all quite common. Physical therapy can help, though. That's the good news. There can be something done here. As physical therapists, and I'm one myself, we are musculoskeletal specialists. So we treat muscles, nerves, fascia, the soft tissue. A lot of our work is in the form of education and assisting people in learning and developing new bladder, bowel, and sexual habits, as well as the direct muscle work that we can do with somebody and promoting physical wellness. So let's talk a little bit about the bladder first. And we'll talk about the healthy bladder and setting the stage for what things kind of should look like, and then how we determine if there's abnormalities there and what we do about that. So typically, one ought to urinate about 6 to 8 times a day, which means every 2 to 4 hours. When you empty, it's a steady stream. You feel like it's complete. The stream ends. You get up, you're on your way. You make it to the bathroom without leaking. There is a normal urge, which means it's an urge. You feel something, but it is not intense. When an urge is super intense or there's no warning, that's defined as urgency, right? And you're able to sleep through the night, perhaps without urinating. Sometimes maybe getting up once or twice, depending on, your age and, sometimes other medical issues or being pregnant can contribute to need to get up at night, but typically you shouldn't have to do that. So to get a sense of somebody's current state, we often will have them do a bladder log. And actually, I'm going to skip slides a little bit here on you to show you, first of all, a bladder log. This is the one that I usually use for patients. It helps to, paint the picture a little bit. So I ask somebody to track what they're taking in, what their fluid intake is, and then their output. So how often are they going to the bathroom and how much? I usually have them count seconds. If they are incontinent, I want them to note that, what they're doing when they are incontinent, and then also how intense the urge is on 1 to 3. So based on the information that they gather for me on this log, we go back and take a look and identify, is there frequency, is there urgency, is there incontinence happening? And then what do we do about that? And there's lots of things that somebody might be doing in their day that can be easily, or at least with some effort, remedied. We talk a lot about how to help smoother emptying and more complete emptying just by positioning on the toilet. So often women, if you sit wide-legged and lean forward, the urethra is more open. And so it is easier to release. It's easier to relax your pelvic floor muscles there. It's also, if there is scarring around the urethra, it's going to help to stretch and open a bit more. So that can be really helpful. Talking about timing of the voids can also be helpful. So there could be frequency. There also could be not going to the bathroom enough. If somebody's got less of an urge, they have nerve damage from their cancer treatment. We talk about kind of tuning into the signals and maybe strategically planning when to go to the bathroom. If we see this big 6-hour window in the middle of their day, they're not urinating, we might ask them, okay, you're going to set your alarm for 3 o'clock, and that's when I want you to void, or at least try, going to the bathroom. If frequency is an issue, or we see they're going, 15, 20 times a day and only for 3 seconds, we might have them try to suppress the urge and not go as often. And of course, this is all based on ruling out bladder issues themselves, right? Or, the cancer isn't the big contributing issue at this point in time. We are now managing a muscular neurological issue. And we know this because the big stuff's been ruled out, and based on clinical exam, we see that there's muscle dysfunction or nervous system dysfunction. So urge suppression, if somebody's got lots of intense urges or they're going a lot, we can teach a lot of strategies that can help here. And so some are listed on this slide, but one of which is to, when you get an urge and it's intense, sit down, take some deep breaths, perform some pelvic floor contractions or kegels, which we'll talk about later a little bit. Distraction is huge. So trying to get the mind off the idea and thought of going to the bathroom. This can be tricky, of course, when you really have to go. But what works for a lot of people is like saying the alphabet backwards or counting backwards by 7 from 100, something that really requires a lot of thinking. That would for me, at least. Identifying if there are any triggers to the urge. So for a lot of folks, like pulling into their driveway or walking into their bathroom or their front door triggers an intense urge. And it's amazing how seeing something can do that. Or the running water is another biggie. So changing how somebody enters their home, pulling into the garage or not pulling into the garage, coming into their driveway from a different direction on the street, going to the upstairs bathroom versus the downstairs bathroom, changing the circumstance or kind of the environment, removing that trigger can be huge in helping to lessen the urge. So we talk all these things through with patients. Back to here, what else? Training items. So we talked about emptying, timing between urge suppression techniques. Incontinence, of course, we look at, and what's the trigger there? Can we identify when that's happening? Is it from a cough, laugh, sneeze, push, pull, lift? Those are circumstances of stress incontinence. That incontinence or leakage is because there is added stress to the body system. Or is it more urge linked, when they really have to go and they're leaking en route to the bathroom? If it's urge based, we use all those urge suppression techniques we just talked about. If it's more because of the cough, laugh, sneeze, more of a stress incontinence issue, we do a lot of muscular training there. Which again, we will talk about here in a few minutes. So moving forward, bowel health. Not unlike bladder, we can have folks do a log here too. So having somebody track how often they're having a bowel movement, the quality of the stool itself. Do they have to, is there pain with it? Do they have to strain? What are their meals looking like? All that can shed light on how behaviors and habits and what's driving the bowel issue. More often than not, it is constipation. Not always, but often. And so I've kind of focused on that for purposes of not talking too much in depth here, but lots of self-care strategies and tips for managing constipation. A lot of these, probably a lot of you know. Some of them hopefully are new and new information for you, but regularity, both in meals and in the timing of the bowel movement, can be really helpful. Eating meals at the same time every day or around the same time, having the bowel movement. If you know there's a time of day that you're more likely to have the bowel movement, trying to capture that time of day and going to the bathroom, even if there is an intense urge, can be helpful. And what you're eating, fiber's helpful. Varied diet. Certainly some foods are more constipating than others. So sometimes working with a nutritionist or a naturopath can be helpful in guiding you down specific foods that route. Hydration is important. Staying active, which is a struggle for folks who are undergoing treatment for cancer when there is discomfort and fatigue. So doing your best. And the goal is not to overdo, of course, because that can make everything much worse. But little walks, short walks, or depending on your treatment protocol, if you know there are going to be times throughout kind of a week or a month even where you're going to be feeling better, trying to take advantage of those times and doing a little more movement over that time period. How you sit on the toilet, just like we talked about with urinating, also helpful for more complete, easier bowel movements. A lot of people know about the squatty potty now. If you don't, it's a stool that tucks under the toilet, but it really is just a stool. So you could just use a step stool or books under your feet, but it's really about bringing your body into a more squatted position on the toilet. You can't change the height of your toilet, but you can do something about changing how you sit on it. And in that squatted position, the anus is more open, so it ought to be easier to fully empty. Colon massage is really helpful. I do this all the time on patients, and of course teach them how to do it on their own bodies. Your long intestine runs from your lower right abdomen up the right side. It runs just under your rib cage across the body and then down the left side. And so stroking with your hands in the direction from right to left along the long intestine can really help with GI motility, bring blood flow to the area, and really, frankly, act as like an abdominal massage, which has benefits too. Really systemically relaxing the body a little bit will be helpful here. And usually I tell people to do this once a day, first thing in the morning, using a little coconut oil or shea butter so that there isn't, too much friction right on the skin. And staying hydrated, I think we already talked about that. That's the last box on this slide. So, managing bladder and bowel symptoms with self-care and habits and training, largely important, but also, of course, as a PT, working on the muscles themselves and how big a role the muscles are playing into their symptoms is, of course, individual. But pelvic floor can certainly be impacted by cancer and cancer treatment, as we already talked about. And of course, we need to identify, is it rooted in tension or is it more because the muscle is weak and atrophied? If it's more on the tension side where that muscle is really tight, then we're going to try to do things to help relax the muscle, and that can take on many forms, one of which is active pelvic floor relaxation, which is when the patient is going to do the work themselves. Breathing, diaphragmatic breathing, is so beneficial on so many levels, but one way diaphragmatic breathing is helpful is to help relax the pelvic floor. I'm going to skip a few slides here to show you a picture of the relationship between the diaphragm and the pelvic floor. So your diaphragm, which lives just under your rib cage, is going to descend when you inhale. And when that happens, that diaphragm drops and there's more added pressure into the abdominal cavity, which is going to result in a dropping or a lowering of or a lengthening, really, of the pelvic floor. So efforts to breathe are going to help that pelvic floor lengthen a little bit. Now, when you exhale, your diaphragm moves upwards, the pelvic floor gets lifted a little bit. So diaphragmatic breathing can help lengthen the pelvic floor and also strengthen the pelvic floor. So depending on the intent, we put more focus on one or the other. But either way, breathing can be super helpful. So back to our primary slide on the muscle work here. Alignment and posture can impact how well you can use a muscle. I often will have patients stand in a few different ways in my clinic and have them kegel or do a pelvic floor contraction in all those positions so that they can feel the difference in how well or how much easier it is to do that contraction based on how they're standing. So how your pelvis and your rib cage is oriented is going to impact how much control you have on the muscle, and that can be helpful and powerful. Yoga poses, again, I'm going to skip a slide here to show you a few favorites. Happy baby, full squat, modified or propped up child's pose. These are not unlike positions of delivering a baby because they help to open up the pelvic outlet. So when we're trying to lengthen the pelvic floor and relax it, these positions can be helpful. We use lots of props, so bolsters and blankets and yoga blocks to assist in getting somebody comfortably into these positions. We might modify the pose even. Okay, and then contract, relax, what I mean by that, and that's still under this active pelvic floor relaxation category, is kegels. A kegel, which let's just talk about that for a minute, is a pelvic floor muscle contraction. It's using all your pelvic floor muscles together as a group. Kegel is just the name given to it. It's the last name of the person who coined it, right? But when somebody's got tension through their pelvic floor, we of course don't want them to be doing 50 million kegels a day because that would further tighten things. But we could have them do a handful of them every day for purposes of feeling and being mindful and getting a sense of what it feels like to do the opposite of what we want them to do, so they know what or how or kind of the direction we need the muscle to move to relax. Manual release techniques are used a lot depending on your provider or even the patient. Different techniques work best or are chosen, and they all have their place. They can be done externally, they can be done intravaginally, they can be done rectally, directly on the pelvic floor, or on muscles in close proximity. All our muscle system is connected via the fascia, and the fascia is this thin connective layer of tissue that encases all of our muscles. It's like this spider web network. You could even argue that your arm muscle is connected to a muscle in your back because of these fascial connections. So when we are talking about, for purposes of this talk, the pelvic floor specifically, working on muscles, especially like the abdomen and into your glutes, or those muscles in your buttocks or your inner thighs or spinal muscles, are going to really have an effect on pelvic floor relaxation too. We also use a tool called biofeedback, and we use sensors directly on the muscles. They can be externally or they can be intravaginally or even rectally. And it's going to these sensors measure the voltage sum of muscle action potentials. What does that mean? That really means measuring your ability to contract and release. And these sensors are connected to a biofeedback unit, which is also connected to software program on the computer, and it gives the patient a noise or a picture or both, such that when that patient contracts, there's an increase in volume or a upward movement of the graph, and when that patient relaxes the muscle actively, they can hear that noise lessen or see the graph lower. So for folks who are visual learners, it can be a really helpful tool. Sometimes, if you've tried other things, you've tried to do the stretches, and we've done some manual release works, and we've done a lot of breath work, and we're still not feeling like that pelvic floor is as relaxed as we want it to be, then biofeedback can be just another tool to use. Okay, let's move forward. So still talking about muscles, specifically pelvic floor rather, if we feel like it's more of an atrophy where there's less muscle bulk, and this is determined via clinical exam, we are going to focus more on strengthening, more on getting somebody to feel and find the pelvic floor and tighten it with their breathing, or changes in how they're standing or moving, giving them different visual cues, or even verbal cues, like saying things like close all your openings or bring your sit bones closer together, or giving them an image of something. It just depends on what's helpful. I get people moving in a lot of different ways. Again, I'm going to skip around a little bit here on you, but lunges and squats and steps, walking, movements that patients have done thousands of times before, but with a little bit more mindfulness on tuning into the pelvis and the pelvic floor and utilizing the glutes with the pelvic floor or the abs with the pelvic floor can be helpful because, again, they're all close to each other anatomically. They share a lot of the same nerve innervation, and they are synergistic, so they work together. We don't really do a lot in life using one muscle group. We work in using patterns of muscles and in multiple muscles working at one time. So trying to get somebody to move with those synergistic groups or using those synergistic groups can help somebody fire into their pelvic floor better. You can also use biofeedback for strengthening as well. So that's a little bit about managing the bladder and bowel symptoms that come about, both from a kind of behavioral standpoint and also focusing on the muscles. We now will talk a little bit more about pain that can be happening, both pelvic, lower back, perineal, abdominal, I'd put in this category too. And the pain we've talked a little bit about, but can be a result of impaired tissue, decreased vaginal lubrication, muscle guarding and tension, and of course, stress or that emotional component. So impaired tissue can take form in the form of scarring. And what do we do about that? Well, we can mobilize the scar. We can, pain from the scar is usually a result of tension in the surrounding fascia and maybe muscles. So we can mobilize that scar. It's a type of massage to help remodel the scar tissue and help do a little myofascial work where we're helping to lengthen and reshape the fascia in and around the area. This can be performed. I do this all the time with patients, but I also teach them how to do it on themselves. And this can be done externally. It can also be done intravaginally and interrectally, depending on where the scar is and, of course, the cancer treatment that was performed. Vaginal dryness might be an issue as a result of the hormonal changes and or surgeries that were performed. And the biggest treatment here is moisturizing, right? Like when our hands are dry, we don't think twice about putting hand lotion on. When our face is dry, we put facial moisturizer on. Of course, you can put moisturizer on vaginally. I don't know why we don't talk more about this. Your vaginal tissue is very thin and fragile and very susceptible to dryness from hormone changes. So I talk a lot with patients about applying even just a water-based lubricant, never mind for intercourse, but just for moisturizing purposes on a very regular basis. And you can use it on the vulva tissue, so on that external region, or you can use it vaginally. And you want to pick a lubricant that has few chemicals. So anything that's marketed as warming, cooling, stimulating would have chemicals in it. Glycerin you want to avoid because it's a drying agent. Some vegetable oils, particularly one I'm familiar with, coconut oil, is got antibacterial properties to it, and you don't want to use that because you have naturally occurring bacteria in your vagina that you want to keep. So paying attention to the type of lubricant you use is important. I've listed out some good ones here. We have samples of a lot of these in the clinic, and they can be ordered pretty easily. Not lubricants that are typically carried in drugstores. Silicone-based lubricant is just another type of lubricant, and that can be more helpful with intercourse. So if somebody's having a lot of pain with intercourse and we feel it's very much triggered because of dryness, using a silicone-based lubricant might be more beneficial than a water-based lubricant because it will stay slicker longer. So water will ultimately get absorbed. So somebody might find that using a water-based lube works great in the short term, but after a while, if the tissue feels dry again, and that's probably because it's been absorbed. The silicone lubricant will keep things more slippery. Okay, muscle guarding is an often cause for pain. So similar to managing, pelvic floor hypertonicity with regards to bladder and bowel issues, the same thing applies when we're dealing with pain issues. So the yoga stretches, the breath work, working on how somebody stands, manual release techniques, the biofeedback. Dilators is another tool that can be helpful, and we haven't talked about those yet. So let's take a moment to talk about dilators. So dilators, I should have switched the order of these slides, but I'm going to skip a slide here. This is what dilators look like, so you can just see a visual first. They come in various sizes. They are fitted into the vagina, and it's helpful to have your physical therapist assist you in finding the right fit. The key is that it's snug, but it is not painful, because we want it to stretch. So the main purposes of the dilator are to stretch and relax the pelvic floor, and your whole vaginal cavity is muscle tissue. So by inserting something inside, you're helping to stretch. You're also desensitizing the vulva and vaginal tissue by putting something in that you know is not going to be painful, but it is still challenging for you because it's something that might be a little bit familiar and or like things that are painful, perhaps intercourse, using a tampon, a gynecological exam. And it helps to reduce the fear of this activity because you're doing something very similar to that painful activity, but in a more controlled way, right? You or your partner maybe is helping you with it. You're doing it. You know in advance that the size is comfortable. You might start with a small size and move up, and you might have a particular size that you need to get up to based on the goals at hand. So whether it's the size of your partner or the size of the tampon that you want to use, or, a speculum for a gynecological exam. Lastly, but certainly not least, addressing the inability to have an orgasm is something that a physical therapist can help you with, especially if it's related to pelvic floor dysfunction or nerve damage. It can also be because there's a decreased blood flow and or, that kind of fear, anxiety component. So treatment is often multifactorial. It can take shape of pelvic floor relaxation techniques like we've already talked about. So, the breath work and the stretching, and maybe using the dilator here too. Diaphragmatic breathing, because it promotes pelvic floor relaxation. It also can help just have a generalized calming effect on the body. Self-massage can help to relax the muscle tissue. Can also lead kind of into that practicing self-pleasure or use of a vibrator, which I have listed below. Basically trying to get them to know you now, right? Which might be different because you've had surgery or you've been through, radiation and chemo, which can have changes on your anatomy. And so what felt good in the past might not feel as good now, but different things might feel better. Different, strategies for sexual activity might be helpful. So kind of talking somebody through and getting to know their new anatomy, and also working and processing on emotions that all folks with cancer and creates treatment certainly have gone through. So reconnecting with your body and working on your view of your body now, communicating with your partner is huge. And of course, seeking a therapist as needed or talking with your current therapist about these issues can be helpful too. So in conclusion, cancer treatment is the top priority, but don't let survivorship overshadow the bowel, bladder, and sexual health symptoms that can really be treated and managed. The oncologists at large are a great group of individuals, and they are very good at helping you treat and manage the cancer. but their top priority isn't the perhaps side effects that have come about as a result of all of that, specifically bladder, bowel, sexual health that I've talked about. So talk to them about it, bring it up, and they can guide you on what to do about it. And maybe, write the referral. Tell them that you want the referral to see a pelvic floor physical therapist, and seek those of us in the community out. I work at Pelvic Health in South Burlington. We're a great practice. We have 5 providers. But there's a lot of practices in this community. We're very lucky in the greater Burlington area to have quite a few PTs who have been trained in pelvic floor work, and work with women and men who have gone through cancer and cancer treatment. So I will be with you now live to answer any questions. Thank you.